Good afternoon, everybody. I hope you are still awake. Still one more lecture after me, so bear with me. So today I'll talk about sperm wash. Why do you need to do sperm wash? Why you don't just take the sperm, just centrifuge it, concentrate and take the sperm and inseminate it directly? We are doing the IUI just to overcome like lack of motility in the sperm or lack of sperm count. Why we do? Because semen is usually a mixed motile and immotile spermatozoa, also contain debris and microorganisms. The presence of all of them together, they caused a reactive oxygen species. This interfere with the spermatozoa and cause DNA damage. So we have to remove all these to get only the concentrated sperm to inseminate it. Also, for the Also, for the final maturation, for the spermatozoa to be able to fertilize the ovum, it needs to go through capacitation. And this will take sometimes after it's been ejaculated. So the presence of the semen plasma and all I said will cause decapitating factors. For semen wash, we need a specified IUI lab with the equipment. We can divide the equipment, some permanent equipment and some disposable ones. The permanent equipment is, this is a minimum requirement for any IUI lab. Anyway, not working. Okay. First, we need a centrifuge machine and a microscope attached to a data system, that is a computer, and a sperm counting chamber. This is applied here in the microscope to count the semen before wash and after wash. And we need, the most important one is a laminated laminated flow machine. Presence of it is very important for the IUI lab because it helps with the technique. Its absence may not interfere much, but it's better to be there. As we said, this is the data attached to the microscope and a warmer where we are keeping all the sample to be in the temperature around 37 degrees. And in some labs, we need this nitrogen for the preserving of the semen. If we are not going to do the IUI, but it's better as soon as you finish the technique, you inseminate it afterwards. The disposable ones is these down ones that we need the sample collection, syringe and cannula, and a conical bottom tube. Well, these are the pipette that is used for the insemination. These are all kept in the lab. IUI lab setup, as it said here, we have one side is the processing equipment and one side the computer and the data plan. And attached to it, ideally, should be the IUI room, in a cozy room, private area, comfortable. And ideally should be it attached to the lab. So as soon as you finish the technique of you semen the wash and you just go directly and inseminate it. There will be not much time between the process. Now, how do we collect the semen for processing? It's need around 2 to 6 days for the sample, for abstinence before the sample collection. Ideally, around 3 days is good enough. Three ways of collecting the sample. The most common way is to collect the sample by the clean cup by masturbation, or collecting in a condom. Not the regular condoms. These ones contain a spermicidal material, so it will interfere with the cause dead sperm. We usually collected in a silicone, special silicone condoms. These are contain no spermicidal, so these are the ideal ones. And the other one is to use the assisted ejaculation in a paraplegic patient, where use the electro-ejaculation to collect the sample. Already, my colleague has described the WHO criteria for 2021, and we are going to use this as a reference for us. Some terminology is used when somebody is saying like oligospermia. What is it? That means sperm concentration less than 16 million per ml. Cenospermia, when the motility is less than 42%. Teratospermia, when the abnormal form is more than 96%. Azoospermia, when there is no spermatozoa in the semen. These are the most important one you are using on daily basis. Now, after we got the sample collected, and then for the naked eye, how it looks like. The normal one, it should be, according to WHO criteria, should be whitish to gray opaline. Now, if it is yellow, it's been maybe it's contaminated with a urine, or maybe the patient has jaundice. Sometimes if it is pink or reddish or brown, contain blood. So these are not a perfect sample for insemination. Liquefaction time, normally between 15 to 30 minutes after collection. Now, if it has gone more than 60 minutes and still lumps are there, these called unliquefied jelly, either because there is some prostatic infection or because of lack of prostatic protease. And if it is still afterwards thick and it is like a jelly form and high viscosity, the sperm will not be able to move through this gel. Still, like before going to do the processing, we found still it is not done. We can help into this matter. We use a needle, okay, to just go through needle with a syringe, not to aspirate and inject it going again and again. This will cause foam, and this will interfere with our process. Now, what we will do, we'll take a needle, we'll just go through in a transverse or longitudinal movement, just to break through these threads, long threads, and make it more in the liquefaction matter. Now, why we do need to do the wash? We do need to do the wash because we need to remove all this plasma and dead sperms, and we need to concentrate the sperms so that it will be in a good amount for insemination. How we do this? There are three basic ways of do the insemination, sperm washing, sorry. Either the first one is sperm migration that we call swim-up technique, and the other one is the highly selective washing technique, that is the density gradient. And the least one used is the simple dilution and washing. Now, how do we know which one to use? That will depend upon the sperm count. Now, if you have a normal patient, they have normal sperm count and it is more than 16 million or more, and we are just want to like unexplained infertility or HIV patient like this, we use either the swim-up technique or the density gradient. Both are of equal amount result. Now, if we do the IUI, because there is a lack of motility or semen count, we better go with a density gradient, because this will give us a good amount of concentrated and good quality of semen. This is usually like the sperm count between 5 to 15 to 16 millions. The last one, the simple washing, usually we for this patient, we don't use if they're less than 5 million. Ideally, if a patient with a semen analysis of less than 5 million, they should go for IVF-XC. But sometimes, like because of financial problem, they cannot offer to go for IVF. We can just try to help them in the process of getting pregnancy. Just do simple wash for the semen sample, and then try, maybe they can get pregnant. We are not much helpful, but this is just a simple way. Now, how we do each one of them? Swim-up technique. What's the principle of swim-up technique? The principle is that the only good sperm can move. So can move when we put washing media. So the good sperm can go up and be in this media. The other ones we can discard and go. So this is how we will usually do. We have like, this is the media, washing media. Either it comes in small jar for single use, or it comes in big container. We can take from it and use it for a single use. These usually kept in the fridge between 2 to 8 degrees. We have to remove this equipment, the media, between 20 to 30 minutes. Keep it on the warmer that we have seen previously. Keep it there. The warmer should be around 37 degrees. Keep it there to get in the normal temperature. Then we will take our sample of semen. We got it. We take one drop, test it before we do all the wash. So just test it and read what is the motility and form and everything. Then we registered, then we start the processing. Now what we will do the processing? The process, we will take a sample, like about 1 ml or 2 ml of the semen, and then put same amount of the liquefaction, the media that we have seen before. Then put it in the centrifuge, okay, for 15 minutes at 2,000 round per month. And then after that, we can see there will be 2 separate layers. One, the down one, we call it the pellet. That is the concentrated semen. And the up one is the plasma and debris, whatever is there. What we will usually do, we'll remove the top layer, we'll aspirate, remove the top layer. Okay, keep the pellet, the concentrated one. Then we'll add again the media, that is the wash media. Keep it in the incubator, okay, on an incline of 30 degrees. We'll keep it for 45 minutes. What happened in this time? This time, whatever good sperm, motile sperm, will swim up and go into this, the top layer. We have added that media. Okay, after that, what we will do, we will take the supernated layer which contained the motile sperm. Take it, put it in another test tube, discard the remaining. Now, again, we will do the same process. We'll put some more of this washing media, then concentrate it again through the top layer and take the pellet, that is the concentrated one. We'll add 0.5 ml of the washing media just to liquefy it. The sample is ready for insemination, but before that, we'll do test again. Take a sample, put it under the microscope to see how much now is the sperm concentration after we have done all this process. Understood? Okay. Okay. So I'll skip this already taken out. This media. We have taken one sample to check for the semen analysis. Now we'll take this tube, test tube, put a semen sample, put the same amount of the washing media, put it in the centrifuge for 15 minutes under 2,000 round per minute. After centrifuging, would make 2 layers, one top layer, one down layer. The down layer is called the pellet. This is the concentrated sperm. The up one is the plasma and debris. We'll remove the top layer, that is the plasma, and take only the down one layer, that is the pellet. In the process of removing the plasma, try not to disturb the palate, okay? Because these are the concentrated sperm, down one. We'll add again one wash media, and then keep it in the incubator on an included 30° for about 45 minutes. And this time, the good sperm, which is down here in the palate, will swim up in the media. After 45 minutes, we will collect the supernated sample, which contains the good sperm, discard the remaining, put this in new sample and another test tube. Again, process one more of concentration. We'll add one media, put it in the centrifuge, remove the top one, and take the pallet, the concentrated sample at the bottom. We'll add 0.5 ml, ready for insemination. This is the simple one, is the SUMAP technique. Now the other one is the density gradient. What is the principle of this? They call it also highly selective sample. Because the sperm has different density, okay, we added some two type of materials. One is like 90% density, and the other one is 45 or 80 and 40, like half, 50% less. These two layers will add with the semen, and then according to the density, the good sperm will be at the down layer, and those dead sperm will be less density, and the semen and the plasma and debris will be less density, so will be in the top layers. So how we do this one? These are three sets of materials. Number one, number two, and the wash. They call level 1, level 2, and wash. Okay, as we said here, they are coming in single use or they are coming in multiple use. You will take from each one the amount needed. Same process will go again. I'll skip this one. He already knows how to prepare. Now we'll go this area. Now we'll put the down layer, is the lower layer, they call it, of one of these materials. Then the second one is the higher layer, and the top one we'll put the liquefied semen. We'll put this all in the centrifuge. Okay, same for about 15 minutes. And then after that, we have 3 layers here found. Previously, we had 2 layers. Now in this one, we are having 3 layers. The 3 layers, the down one is the pallet, that concentrated sperm. There is some zone in the middle that is called the immotile sperm, and the top one is the plasma and debris remaining. What we do, we will remove the supernated, the 2 layers, and keep only the down is the pallet. Now after that, we'll start 2-time process of washing. We'll put the wash, the third jar is the wash, the same like the previous one that in swimmer. Like we'll put it, centrifuge it, and then we will remove the top layer, that is the plasma and debris. The pallet is the down layer. Again, we'll do one more again, and then finally we'll add at the end 0.5 ml, and now ready for insemination. Of course, we will take one drop to check for the semen count before going for insemination. Okay, understood? Fine. They are the same technique, but the material used is different. This technique is what we are going to use in our IUI lab. Okay, we have asked for the materials. We are waiting for it. Ready? Come, good. Okay. Now, simple wash. As we said, generally we are not using this one, but just the last resources for a couple to use. Okay, this use when the sample is very poor in quality. That means less than 5 million spermatozoa is there. It's usually dilution and centrifugation technique only. Okay, so we'll take 1 volume of the semen and we'll put over it 2 volumes of the culture media and then centrifuge. Again, we'll make the process again. Twice we'll do, and then we'll take that the pellet, the remaining, put some little of the culture media, and then ready for insemination. So this is the simple way of doing it. Now, some points to remember and take care. Now, before starting any of these process, we have to make sure that all our equipment is pre-equilibrium. Like that the warmer is around 37 degrees, okay, and that our machine is centrifuge is working correctly before starting any process. No, and then we need to use the laminar flow. That is the best things to be done. I said if it is not available, okay, but if it is there, it's better because it's good, give a better quality of sperm. Now, if we were doing this process, we had some air bubbles while we are mixing it. So we just need to remove these air bubbles, just aspirate it in the pipe and remove it. And the most important things, do not disturb the pellet. If mix it again, then all our process, what we have done is ruined. We have to restart over again. Now, after we have finished all and ready, the better is to inseminate as soon as possible. I can wait up to 45 minutes, but within 15 minutes of preparing the semen, it should be inseminated. For any reason, it could not be done. As we said, they can be frozen and kept for re-insemination again, but this will make the quality of it little less than if it is just directly inseminated. These are my references. Thank you for hearing.